Hi, my name is Skylar Hubbard and this is my MedPass validation video. So the first thing you would do is check whether your patient is NPO or PO. Our patient today is PO, which means they can orally swallow drugs. The first drug check we're going to do is check the doctor's order for accuracy. So the drug we're giving today is on 3/30/2020, which is today's date. The patient's name is Miss Bear. Ibuprofen's the drug, 200 milligrams dose. PO orally, which is the route, time as soon as possible, and check if it's a PRN drug, and it is, so that means as needed, and the frequency is every 6 hours. So the doctor's order looks correct, nothing's missing, and nothing is out of whack. So now we're gonna perform hand hygiene and prepare the necessary equipment. We need our med cup, and we're going to pull the drug on the order out of the med cart. This is where we do our second drug check. We're going to check the drug on the label with the drug order to make sure it's correct. Ibuprofen, 200 milligrams, PO, this is correct. And we would do our calculation dosage for this patient, and the order was for 200 milligrams on the bottle, 200 milligrams, so that we would give 1 tablet. So the way we could administer, if it comes in the bubbling, you just set it in the cup and take it to the patient's room, flick it into the cup like this kind of motion, and then without touching it, and administer to your patient. If your drug is in this type of container, you're going to open it, take the cap, and slowly pour how many tablets you need. We need 1, so we pour 1 into the cap, and then pour it into the cup, and there's your medication. If you are doing a liquid like we have here, you would set your med cup on a flat surface, crouch down, and pour, and look at the lowest level of the meniscus to read how much drug is in your cup. Since we are done preparing, you would check the label of your drug and put it back into the med cart. With your prepared medication doctor order, med order, we would put it on this tray and take it to the patient's room. Hi, my name's Skylar. I'm your nurse for today. Can I get your name and date of birth? And I'm just going to check your armband here. Okay, perfect. Her name is Miss Bear, and her birthday is 11/3/2000, which she just voiced accurate. And we have the right patient for our drug order. So, Miss Bear, is that okay if I call you that? Yes? Perfect. Okay. So now, the doctor has ordered you some ibuprofen, 200 milligrams, for the back pain you are having. Can you tell me the pain level that you are having on a scale of 0 to 10? A 6 out of 10? Okay, this med should help. And before we administer, do you have any allergies we should know of? No? Okay, perfect. So if our patient had any allergies and it was aspirin, this is one that you would want to be alert for, because ibuprofen, when given for a patient who's allergic to aspirin, can increase the severity of the allergic reaction. Okay. So this medication that has been ordered can be frequently given every 6 hours as needed for your pain. Okay. So now I'm going to sit you up in the position that makes it easier for you to swallow your oral drug. Okay. So you would sit them up in an upright position. So now, this is where we do our third and last final drug check, and we're going to check it with the MAR prior to immediate administration. So it's perfect. We have our correct dose, correct drug, and correct time and route. So now we're going to get a sip of water, some water that they can take a sip of to help with the oral swallowing. So hi, Miss Bear, here's the drug, and here's a glass of water to help with the oral administration. Okay. Miss Bear, did you have any difficulty swallowing at all? No? Perfect. So if we had a psych patient or a ped patient, we would want to check that they swallowed the drug by asking them to open their mouths, because with psych patients, they could hide them in the pockets of their mouth and then hide them under the bed or in their pillowcases. With ped patients, they could just not be able to swallow it or spit it out, and this is where liquid drugs come in handy with ped patients. So you would want to check the pockets in their mouth. Okay. So, Mister, how would you like to be positioned? Would you like to stay in this position, or how would you like to be? Laying down? Okay, let me help you with that. Okay. So here is your call light if you need anything. So we're going to document. So the time that we gave this drug was 3 p.m. The time we administered it, like right when she took it, 3 p.m. So we're going to document that. The drug was ibuprofen, dosage 200 milligrams, we gave her 1 tablet. Route was PO orally, and the patient did not complain of any difficulties. So there's that. And then we would sign it. Okay. And then throughout, we would check in on the patient and observe for any adverse reactions. So now I'm going to be reading the drug card. So the generic name is Carvedilol, trade name Coreg, classification beta blocker, the normal dose range, route, and time/frequency. So it is a 3.125 milligram PO 2 times a day, and it can also be given in an extended capsule, 10 milligrams 1 time a day. The drug indications are for chronic heart failure, hypertension, angina pectoris, and left ventricular dysfunction after a myocardial infarction. The mechanism of action slash indication, so it's a non-beta adrenergic, so it affects the beta 1 and beta 2 receptors, and alpha 1 adrenergic blocking agent, and this can lead to orthostatic hypotension. It can lower blood pressure and heart rate, and the patient will have an improved cardiac output and a slowing progression of heart failure. The common adverse effects: dizziness, fatigue, hypotension, weight gain, hyperglycemia, bradycardia, diarrhea, and anaphylaxis, which is rare but life-threatening. So interactions with other drugs are contradictions. You would notify the physician if the patient is using other antihypertensive agents, NSAIDs, hypoglycemics, steroids, levodopa, and digoxin, and then also cyclosporin. It's contradicted with a history of serious hypersensitivity reaction to carvedilol, COPD, bronchial asthma, severe hepatic impairment, severe bradycardia, 2nd to 3rd degree AV block, sick sinus syndrome, and cardiogenic shock. The lab value alterations caused by this medication: there's an elevation in the BUN levels, potassium, serum lipoprotein, triglyceride, uric acid, and the blood glucose levels. There could also be an elevation in the ANA titers. So with the nursing implications assessment and vital signs, you would monitor heart rate, blood pressure, and pulse. You would monitor the ECG, monitor blood levels and other imbalanced lab values for use with digoxin or cyclosporin. Monitor breath sounds, intake and output, and weight daily. Monitor renal function during up-titrating of the drug. Rise from lying to standing very slowly due to orthostatic hypotension. And since anaphylaxis is rare, you still watch for it, because you would monitor for hives, swelling of the throat, lips, and face, because it can cause the inability to breathe and swallow. And then you would assess the patient for fluid overload, and you would monitor the signs and symptoms of overdose. The patient education: Coreg must be taken with food in the morning. You would take the exact dose prescribed. Avoid driving or any hazardous tasks due to dizziness or fainting. Decrease lacrimation for patients who wear contact lenses. If the patient experiences any symptoms of dizziness or fainting when standing, you would tell them to sit or lie down if they feel that, and tell your physician if you're pregnant. Also, you would store this drug at room temperature and keep tablets dry. And you would teach your patient how to check their own blood pressure and pulse so they can perform it daily. And you would do this type of teach back to watch them and make sure they're doing it correctly. And this medication may increase sensitivity to cold and encourage them to continue their additional therapies for hypertension. And also, if they get an extended release, like drug, make sure you tell them not to crush it. And before administering, you would take the apical pulse. If it is 50 or below beats per minute, or if arrhythmia occurs, you would withhold the medication and notify the healthcare professional. Thank you. That is my MedPass video. Thank you.